Masculinity research is important because gender is a relational concept. It's built on the relationship between masculinity and femininity. Gender norms and expectations affect both men and women in society, so it's important to focus gender research on both women and on men. The key findings of this research so far has been that there are actually very limited services that are targeted specifically at men. And this is problematic because of particularly the stigmas around engaging in mental health initiatives. Not having services available can deter men further from engaging with such services. But one other point that was revealed in the research is the importance of innovative programming. So, for example, by shifting away from standalone psychosocial support programs and integrating these initiatives into, for example, livelihood initiatives or social cohesion programs is a better way of engaging men in such initiatives. It's really important to continue this research because by not making services available to men and boys, we risk reinforcing stereotypes. Stereotypes particularly around this idea that men can somehow cope themselves. And this is problematic from a well-being perspective in terms of the individual themselves, but it's also problematic in terms of conflict prevention. Now, we know from other research that men can develop maladaptive coping mechanisms, which may include withdrawal, self-harm, but also violence in a variety of forms. For example, violence in the home, in the community, and also political violence. Now, this is not to say that all men that suffer mental health difficulties or suffer from trauma are going to somehow become violent. But it does mean that it's important to make those services available for men and boys, and that where they're made available, that they are designed in a way that takes into account a masculinity perspective. So my hope with this research is that as we continue, we can learn from a variety of organisations that are working with men and boys what is the best way to engage and how to engage through a masculinity lens, but also to reinforce the need for services available to men and boys. I would also hope that this research showcases how important it is to work on psychosocial support programs for men and boys in a way that does not overshadow the need for services also for women and girls in conflict contexts.